Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. What are endocrine diseases and how do they affect fertility? Endocrine diseases are medical conditions that affect the endocrine system, which is a network of glands that produce and release hormones into the bloodstream. Hormones are chemical messengers that regulate various physiological processes in the body. These include growth, metabolism, immune function, and reproduction. When the endocrine system malfunctions due to a disease or hormonal imbalance, it can have profound effect on fertility. Let's look at how it can impact fertility and what are the different kinds of endocrine diseases. Polycystic ovarian syndrome. Now, PCOS is a common endocrine disease or a disorder among women of reproductive age. It is characterized by irregular or absent periods, high level of androgens, which are male hormones, and the presence of small cysts in the ovaries. PCOS often leads to anovulation, means the lack of ovulation. Egg is not releasing in such conditions, making it difficult for women to conceive. Elevated androgen levels can also disrupt the ovarian follicular development and increase the risk of insulin resistance, which further has an effect on fertility. Next is hyperthyroidism and hypothyroidism. Thyroid disorders include an underactive thyroid called as hypothyroidism and an overactive thyroid called as hyperthyroidism. This can disrupt the delicate balance of hormones, the hormones that the thyroid produces, also the imbalances of reproductive hormones. Hypothyroidism can result in irregular periods, anovulation, and reduced ovarian reserve. This can lead to fertility problems. Also, hyperthyroidism may lead to increased menstrual flow. Period may be very heavy, irregular periods, and a high risk of miscarriage. The next endocrine disease that I would like to mention is hyperprolactinemia. This condition involves elevated levels of prolactin, a hormone responsible for milk production in breastfeeding women. High prolactin can suppress ovulation, disrupt the menstrual cycle, and cause galactorrhea, which is abnormal milk secretion from breast, all of which can cause infertility. The most important endocrine disease that we should talk about, diabetes mellitus. Both type 1 and type 2 diabetes can impact fertility. Uncontrolled diabetes can lead to insulin resistance and hormonal imbalances. Diabetes can result in irregular periods, decreased ovarian function, and an increased risk of miscarriage. It can also affect sperm quality and erectile function in men with diabetes. Next is adrenal disorders. Conditions affecting the adrenal glands such as Cushing's syndrome, which is the overproduction, excessive production of cortisol, or Addison's disease, which is insufficient cortisol production, can disrupt the hypothalamic-pituitary adrenal axis. So all three need to function properly. So this will be disrupted, affecting reproductive hormones. These disorders can lead to irregular periods, anovulation, which is lack of egg being released, and impaired ovarian functioning, impacting fertility in both men and women. Hypothalamic-pituitary disorders. Tumors or dysfunction in the hypothalamus of pituitary gland can disrupt the release of gonadotropin releasing hormone and luteinizing hormone, which is essential for not just ovulation but also for sperm production. These disorders can lead to lack of egg release, amenorrhea, which is the absence of menstruation, and impaired spermatogenesis in men, means the process of sperm's production is impaired. Now, managing endocrine diseases and optimizing hormonal balances through medical treatment, lifestyle changes can often help restore fertility or improve the chance to succeed in fertility treatments such as IVF or ovulation induction. If you are experiencing fertility issues related to endocrine diseases, you should seek medical evaluation, guidance from your endocrinologist, and who will look at the underlying problems and look at the hormone imbalances and treat you for it. If you wish to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.